and welcome to the first module of the Screening, Brief Intervention, and Referral to Treatment curriculum, or SBIRT as we call it, that you will be learning about and using in the social work MSW program. My name is Mo Cuevas, and I am the director of the Warden School of Social Service, and I'm one of the faculty who's working with the SBIRT program to help you get these skills so that in whatever setting you go out into, you can be screening for, briefly intervening, and referring to treatment for folks who have substance use, misuse, or disorders. The material that you're about to see is mainly from the works of previously funded SAMHSA grantees. There are also other information sources that will be noted. The core curriculum modules of the SBIRT training consist of 5 different areas. 4 of these we will be doing in this course. What is SBIRT and why use it, which is the one you're viewing now. Screening for substance use disorders. Essential motivational interviewing skills. Brief intervention. And then in another course, you'll work on referral to treatment. By the end of the session, you'll be able to define SBIRT, describe its value, and answer the question about why you might choose to support SBIRT implementation. SBIRT is screening, brief intervention, and referral to treatment. It's a public health approach to the delivery of early intervention and treatment services. Social service agencies, hospitals, and other community settings provide opportunities for early intervention with at-risk substance users and for intervention with people who have substance use disorders. It's based on motivational interviewing strategies where you universally screen everyone to quickly assess the use and severity of use, misuse, or abuse of substances. You briefly intervene, providing motivational and awareness-raising intervention, and you give that to risky or problematic substance users. And you refer to treatment, to specialty care, for clients who have substance use disorders. Why might I choose to support SBIRT implementation? That's a good question. Do I really have to do this thing? Well, it is your choice, but it's part of your class, and so you need to at least do the assignments. There really isn't much hassle involved. It's really just like getting other demographic data, and it doesn't seem to annoy clients. In surveys done on their attitudes, 92% agreed or strongly agreed that if my social worker asked me how much I drink, I would give an honest answer. 96% agreed or strongly agreed that if my drinking is affecting my health, my social worker should advise me to cut down on alcohol. 86% strongly disagreed or disagreed that I would be annoyed if my social worker asked me how much alcohol I drink. So most people don't feel like they'd be annoyed or embarrassed. They just want to have an honest conversation about it. SBIRT is important because unsafe alcohol and drug use are major preventable public health problems that result in more than 100,000 deaths every year. The cost to society are more than $600 billion annually. And all of these issues have far-reaching implications for individuals, families, workplaces, communities, and the healthcare system overall. Harms related to hazardous alcohol and substance use include increased risk for injury or trauma, for criminal justice involvement, for social problems, for mental health consequences, and for absenteeism and accidents in the workplace. Unfortunately, too many accidents on the roads still happen. The evidence indicates that moderate risk and high risk drinkers account for most of the problems. If you look at this bar graph, light drinkers don't really account for much of any of the problems, maybe 10% at the most of health issues, but less than that in terms of aggression, in terms of problems with the spouse, in terms of problems with your job, in terms of problems with your friends, and very little in terms of accidents. Typically, substance use was only acted on when people met the abuse and dependence criteria. So rather than use prevention strategies, we worked on the problem after it developed. There was a significant gap in services for at-risk populations. In rethinking that, in the past, over here, we just worked with dependent users. Now we're rethinking it and want to work with at-risk and binge users as well to try and stop it before it becomes a major problem. In the public health paradigm, all of these services are aligned. So early intervention, right here, is SBIRT and other brief interventions. Treatment is based on evidence-based practices, and maintenance is using recovery supports, self-help, and other peer support. The primary goal of SBIRT is to identify and effectively intervene with those who are at moderate or high risk for psychosocial or healthcare problems related to their substance use. Evidence has shown that SBIRT is effective, it is cost-effective, and it has demonstrated positive outcomes. And it shows that SBIRT is an effective way to reduce drinking and substance abuse problems. Research shows that brief interventions are low cost and effective, that they're most effective with people who have less severe problems, and that they're very effective reducing alcohol misuse. There is substantial evidence for the effectiveness of brief interventions for harmful drinking. And as this continues, as we continue to use SBIRT, there's a growing body of literature showing the effectiveness for risky drug use as well. Since 2003, more than 1.5 million people have been screened using the SBIRT program. The data confirms that there's been a 40% reduction in harmful use of alcohol and a 55% reduction in negative social consequences. Data also shows that there are positive benefits for reduced illicit substance use. SBIRT is highly flexible. It can be used in all sorts of settings, from behavioral health to community health to mental health, to hospitals, emergency rooms, senior services, school-based services, veterans hospitals, all of these places. Just about anywhere where there's a social worker, you can use SBIRT. By doing SBIRT, we're saving lives and money, and we're promoting the overall client wellness that we want to facilitate. If we wait until later to intervene, the treatment is much more expensive, and clients have often developed other health-related concerns based on their use. Many clients are more likely to discuss this subject with their social worker than with a relative, therapist, rehab specialist, or physician. SBIRT is a brief and highly adaptive, evidence-based practice with demonstrated results. SBIRT has been successfully implemented in diverse sites across the lifespan. Clients are open to talking with trusted helpers about substance use, and SBIRT makes good clinical and financial sense. Thanks for listening, and I look forward to working through the other modules with you.